the bottom of the cool box, so it's about 3/4 of the way full. And then we flatten the dry ice out and we place our cool box snap freezing device on top. And then we'll surround the block with a little bit more dry ice. And then we have to wait approximately 15 minutes for it to equilibrate to that temperature, the dry ice temperature. Right? And the cool box can be a little bit heavy to be transporting from clinic to lab, so we also use a outer cooler with a wheel. Place the box inside the cooler. Easy transport.
You also have to transport GTM over to the clinic, which needs to be kept in -20 or below. And we also put it in these conical tubes upright because sometimes it leaks as the glass defrosts, the seal breaks. So just keep it in these. And then put it with an ice pack or two to keep it upright when you transport.
He's got snot on his forehead and snot in his hair, a little bit here and a big bit there. Poor little baby's got a nasty cold and it's hard to blow your nose when you...
So these are the pre-printed labels. Half go on the tubes and half go on the sheet. And we do it first before we aliquot the specimen.
So for when we do a nasal wash, we need to put on a gown, gloves, and a mask. We do that outside the room because the children get frightened when you put on the mask because they know what's coming. So now it's time to do the nasal wash on the child, and we're going to start with positioning the child. So first she's sitting on mom's lap, and she is going to hold the arms down in kind of a bear hug. She's going to tuck the feet a little bit between the legs so they don't move. We are going to use a blanket around them to protect the clothing and tuck that in. It's good to have a helper help position maybe so they don't move around. I'm going to ask mom to lean forward a little bit so we have a good flow. We have 20 cc's of lactated bringers, and we're going to pull that up into the syringe. We're going to put the cup underneath the nares, and I'm going to squirt the water in, and then it's going to come out the other side, and then I'm going to pour the extra in the cup.
And then after, we like to give them a snack.
So I have the nasal wash, and now I am going to aliquot the samples. So the first thing I'm going to do is I'm going to collect 6 cc's of the nasal wash and transfer it into here. There's 3. And then here's another 3. And then I'm going to set this aside. And then I'm going to collect our BTM, 1.5 mLs of the BTM. Right there's 1.5. I'm going to mix these two together. And now I'm going to aliquot 1 ml in 7 tubes. And then we're going to put it straight into the dry ice. Last one. Put it at that one. Okay, on day 0 and day 56, we need to do an antibody. And what we do for that is we take the extra nasal wash without the VTM. We get a fresh pipette and we pull up the sample and we aliquot to 1.5 cc's. And we cap it and we put it straight on to the ice in the cool box. Lid on the cool box and we're all set.
And then we also send this paper with the antibody stickers on the side to the lab. So then on day 0, after you do the nasal wash, you would give the vaccine, and while they're waiting for the 30 minutes, I use that time to teach about how to use the thermometers, how they contact us if the child has a fever or another issue, and then I talk about scheduling the appointments and how I'm going to get in contact with them the days that they're not seen in clinic.
And snot in his hair, a little bit here and a big bit there. Poor little baby's got a nasty cold, and it's hard to blow your nose when you're not very old. Then here comes Mum, trying to clean him up. She's wiping his face with a hanky. Mum, trying to clean him up, but he's not gonna let it 'cause he's feeling cranky. He was up last night till 3:30. Nobody in the house got very much sleep. Poor little baby's got some teeth coming through, and who can blame him for feeling blue? Then here comes Mom.
As the protocol lab technologist, would you mind explaining to us why the antibody needs to go right into the cool box after it's collected?
Yes, I can do that. It's very important for the stability of the virus and the antibody to be frozen.
Because you have to fill them up all the way.
It's a hot day. We'll let it cool off in the lab.
Thanks.
Thank you, Paul, for everything.